Chronic obstructive pulmonary disease, or COPD, is a group of lung diseases that blocks airflow and makes breathing difficult. Emphysema occurs when the air sacs at the smallest end of the passageways are gradually destroyed. The main cause of COPD is tobacco smoking, with 20% of tobacco smokers developing COPD. The lungs rely on elasticity, or the ability to stretch, of the tubes and air sacs to move air out of your body. COPD causes them to lose their elasticity and become smaller, which leaves air trapped in your lungs when you breathe out. Chronic bronchitis is a condition where the tubes in the lungs become irritated and swollen, which creates smaller tubes and more mucus. This further blocks the narrowed tubes. With chronic bronchitis, you tend to cough often to clear the airways. There are 4 stages of COPD: Gold 1, 2, 3, and 4. In Gold 1, or mild COPD, there may be mild or slight blockage of airflow, and you may be unaware that your lung function is declining. You may not yet have any COPD symptoms, and you may have symptoms of coughing and mucus. People at this stage usually do not seek treatment and do not associate symptoms with COPD. In Gold 2, or moderate COPD, there may be moderate blockage of airflow, and you may start to notice symptoms such as shortness of breath when doing physical activities, along with a cough. Most people typically seek medical treatment at this stage. In Gold 3, or severe COPD, there may be significant worsening of the blockage of airflow, and shortness of breath becomes more evident. Exacerbations and flare-ups, or sudden worsening of symptoms, are common. In this stage, you may notice more difficulty during physical activities and increased fatigue. In Gold 4, or very severe, quality of life is greatly impaired and exacerbations become life-threatening. Airflow is extremely limited. Chronic respiratory failure is present at this stage and may lead to complications with your heart and eventually death. Those are the 4 stages of COPD. Damage from COPD can't be reversed, but treatment can help control symptoms and minimize further damage from COPD. A bronchodilator is a common medication used to treat COPD. It works by relaxing and expanding the airways, making it easier to breathe. Bronchodilators are the preferred method of treatment for relief of short-term symptoms, such as shortness of breath. Bronchodilators also help to prevent spasms of the lungs due to exercise and improve exercise tolerance in COPD. Right, there you go. Beta agonists can be short-acting, which means the effects last between 4 to 6 hours, or long-acting, which means the effects last between 12 hours or longer. Beta agonists can be given orally or by inhalation. The inhaled method is preferred because of the quicker effects and less side effects. When bronchodilators are administered by inhalation, proper use of the bronchodilator or meter-dose inhaler is an important aspect of the effective treatment. The choice of an inhaler will depend upon your prescribing doctor and the ability to use them correctly.